Understanding and Managing Hypertension, the Silent Killer. Today, I'd like to talk about hypertension, often called the silent killer. High blood pressure is scary because it usually has no obvious symptoms, making it hard to notice. However, if left untreated, it can lead to serious complications like stroke, heart attack, and kidney failure. Let's take a closer look at what hypertension is, why it happens, and how to manage it. What is hypertension? Simply put, hypertension means high blood pressure. It's a condition where the force of the blood pushing against your artery walls is consistently too high over a long period. Imagine your blood vessels are like pipes. They are the pathways that carry essential nutrients and oxygen-rich blood from your heart and lungs to every part of your body. But what happens if the pressure inside these pipes gets too high? Over time, the vessel walls can become thick and stiff. This is often closely linked to poor lifestyle habits. Smoking, lack of exercise, and a diet high in fat and salt damage the inner lining of the blood vessels, causing cholesterol and fatty deposits to build up, which are the main causes of high blood pressure. Why is hypertension dangerous? Consistently high blood pressure puts an enormous strain on both your heart and your blood vessels. This can cause vessels to rupture, blood clots to form, or blockages to occur, leading to strokes, heart attacks, dementia, and even sudden death. What's even scarier is that this entire process happens quietly deep inside our bodies, so you might not feel any symptoms or signs until it's too late. The only clue is regular blood pressure checks. According to standard medical guidelines, a systolic top pressure of 130 millimeters of mercury or higher, or a diastolic bottom pressure of 80 millimeters of mercury or higher is considered hypertension. Types and causes of hypertension. Hypertension is divided into two main categories: essential hypertension and secondary hypertension. Surprisingly, about 95% of all hypertension patients have essential hypertension, which is caused by lifestyle factors rather than a specific medical condition. The remaining cases are secondary hypertension, which is caused by underlying issues like heart or thyroid problems or sleep apnea. That's why it's important to check your blood pressure regularly and consult a doctor to find the exact cause if your numbers are high. Can hypertension get better? Yes, it can. Especially at the mild stage, it is very possible to recover. The first treatment doctors usually recommend upon diagnosis is lifestyle adjustment. The keys are quitting smoking, regular exercise, and a healthy diet rich in fruits and vegetables. If you've been diagnosed with high blood pressure, there is hope that you can return to normal levels through healthy living. Risk factors for hypertension. The risk increases as we get older. Men tend to see a rise in blood pressure after age 45, and women after age 65. Genetics and race can also play a role. However, having these risk factors doesn't mean you are destined to have high blood pressure. It just means you are more vulnerable, and avoiding unhealthy lifestyles or specific habits is the most effective way to prevent it. Smoking, excessive drinking, obesity, and lack of exercise are the major lifestyle-related risk factors. Smoking uses chemicals that damage the lining of blood vessels and make them narrow. This increases the heart's workload and leads to high blood pressure. Also, the more you weigh, the more blood volume your body needs, which puts a great strain on vessel walls. Therefore, maintaining a healthy weight through regular exercise is crucial. Beyond alcohol and tobacco, what we eat plays a vital role in reducing the risk. Specifically, cutting down on salt is essential for management. Interestingly, Dr. Michael Greger, a famous physician and founder of nutritionfacts.org, emphasizes the importance of a vegan diet for managing blood pressure. According to Dr. Greger, increasing plant-based foods is a huge help. In fact, some studies show that a vegan diet can lower blood pressure about half as effectively as medication. There is also historical evidence. A study of 1,800 patients in a rural Kenyan hospital found not a single case of hypertension. And in rural China, the average blood pressure of a 70-year-old was the same as a 16-year-old. The common factor was that they only ate meat on special occasions and stuck to a plant-based diet daily. Furthermore, the American Heart Association noted that the only group in Western society with truly low blood pressure, around 110/65, were strict vegetarians. A study of 89,000 California residents showed that the more plant-based a person's diet was, the lower their rate of hypertension became. Research also suggests that a vegan diet offers extra protection against obesity, hypertension, type 2 diabetes, and cardiovascular death. In many cases, starting a vegan diet can lower blood pressure in just 7 days, allowing many people to reduce or even stop their medication. This suggests that a plant-based diet is a powerful way to lower blood pressure without drugs. Hypertension is a serious disease, but it is something we can prevent and manage through our own efforts. Based on the information today, try to practice healthy lifestyle habits and consider a plant-based or vegan diet if necessary. I'm rooting for your healthy life.